Hello, it's Diagnosis Bona Kuratse Bona, and today we will talk about diseases of the liver. And so let's start with hepatitis. Hepatitis A, it's a now chronic disease usually and self-limited. The way is indigestion of contaminated food, and symptoms there are preecteric and ecteric phase. So preecteric, it's usually anorexia, nausea, vomiting, malaise, headache, mild fever, diarrhea, and upper abdominal discomfort. If it's a ecteric phase, it's a dark urine, pale stool, hepatomegaly and splenomegaly. And diagnosis is anti-HIV, immunoglobulin M, if it's an active infection, and if it's a past infection, it's an anti-HIV immunoglobulin G. There is no specific treatment, just supportive, so this patient has to rest, follow a fat-free diet, avoid alcohol, smoking, hepatotoxic drugs, and also to prevent spread, this person have to wash hands carefully after using the toilet, do not share cutlery and crockery during meals, and and there is also vaccine, so to prevent hepatitis A. So next is Hepatite B, and transmission is by blood spread, percutaneous, sexual transmission, perinatal spread, or by close prolonged family contact. So, and symptoms here are fever, arthritis, arthralgia, abdominal pain, fatigue, malaise, pruritus, jaundice. Also, it could be dark urine and pale stool. So, and diagnosis, it's a quite tricky. So, I will show you here this graphic. Okay, just a second. So, there are antigens and antibodies. So, and these antigens. So, if you do diagnose acute hepatitis, you have to find the HBs antigen and anti-HBc immunoglobulin M. And of course, if you see HBs antigen, it's definitely tell you about it. It's a acute hepatitis, but there is this window period. So, and at this period, you can find just anti-HBs immunoglobulin M. So C is core, S is surface, and so if it's this HBs antigen, at least more than 6 months, it will be chronic hepatitis, and it can lead to hepatocellular carcinoma. And also, let's talk about this one. It's anti-HBs. It can tell you about that there was previous infection, or also about that this person was vaccinated. So next is Hep C, and the way is IV drug abuse and blood transfusion, Also sometimes the cause is unknown, and symptoms are insidious. They're very and because it could be asymptomatic, but 80% eventually have chronic hepatitis. Symptoms are arthralgia, paresthesia, myalgia, pruritus, Gilbert Syndrome. It means dryness of the eyes and mouth, and also sensory neuropathy. Okay, diagnosis is anti-HCV, current or past, and also when we have to treat it. When PCR positive, significant viral load, and elevated ALT, it means we have to find to know genotype of HCV, because depends on this genotype, the treatment will be different. And for example, for first genotype, it's DAAS, and so it's a direct acting antivirals, also PAG interferon and ribavirin. So next is autoimmune. So it's a chronic liver disease of unknown etiology, and it's usually female. So the symptoms also could be insidious, and also could be fatigue, abdominal discomfort, mild pruritus, myalgia, dysuria, and jaundice. So diagnosis is made by abnormal liver functional tests, and also positive smooth muscle antibodies, and variety of other antibodies, autoantibodies, and also typical liver biopsy. So, and if you see this anti-liver kidney microsomal antibody 1, and it means about this is predictive of a poor clinical and biochemical response to therapy. And so treatment is corticosteroid with or without azathioprine. Okay, and let's talk also about Hepatite D, and it occurs only in patients with concomitant Hep B. So if there is Hep B, it also can add it Hep D, and it's usually spread parenterally, and so diagnosis is anti-HDV immunoglobulin M, and treatment with interferon. So next is hemochromatosis. It's a disorder of iron overload, and it leads to damage to heart, liver, pancreas, joints, and pituitary gland. So you see, so there are a lot of symptoms. So it's tiredness, arthralgia, skin pigmentation, hepatomegaly with or without cirrhosis, diabetes mellitus, impotence, testicular atrophy, and cardiomyopathy. So, and also, so it will be full blood examination and ECR are normal, but just increased ferritin and iron transfer in saturation more than 60%, or 70%, sorry, and decreased total iron binding capacity. So treatment is vivisection. And also I wanted to tell you that there is hemochromatosis. There is hereditary hemochromatosis and is a genetic condition. Also there is hemochromatosis. It's the secondary condition, for example due to chronic hemolysis and multiple transfusions. Next, two diseases. It's Wilson disease and Gilbert syndrome. So both them are, it's a genetic disorder, and it present clinically in teenager years or early 20s. So Wilson's disease, it's when there is excessive amount of copper to accumulate in the body, and it leads to, it may cause liver disease, central nervous system dysfunction, and signs of associated liver disease include jaundice of the skin, mucous membranes, and sclera. Also edema of the legs and ascites, esophageal varices, and also tendency for bruising and prolonged bleeding, also fatigue. Some common neurological symptoms include tremor, involuntary movements, difficulty swallowing, difficulty speaking and poor articulation, so dysarthria, lack of coordination, spasticity. In females, it could be menstrual irregularity, loss of menstruation, miscarriages. Diagnosis, it's a slit lamp examination to find Kaiser-Fleischer ring, and so it's like here, as you see, in the cornea of the eyes. Also low level of ceruloplasmin, high level of copper excreted in the urine, and also some liver tissue changes. And it's important to make screening because as you see, there are a lot of symptoms, and it's quite dangerous, and you can prevent it if you diagnose it earlier. So it's a genetic diagnosis. For screening, it's very important, and there is free medications for treatment. And first, it's to remove copper from the body by urinary excretion, such as penicillamine and trientine dihydrochloride. Second is zinc salts to prevent the drug from absorption copper from the diet. And third, it's tetrathiomylaptate, which both prevent absorbing copper and binds up toxic copper in the blood, making it non-toxic. So, and therefore zinc acetate has been approved for the maintenance treatment for patients. So after treatment, this person will take zinc acetate or calcium. Okay, so the next one is a Gilbert syndrome, and it's a disease when there is reduced activity by the enzyme leukoenzyme transferase, and it's when there is a presence of mildly elevated and conjugated bilirubin level in the blood, and there is some such criteria for Gilbert syndrome. So if it's repeated and conjugated hyperbilirubinemia, no evidence of hemolysis or with normal finding on complete blood count, reticulocyte count, and blood smear. So normal liver functions test except for the bilirubin, and so it's always asymptomatic. Just sometimes it could be yellowing of the eyes, and this syndrome will not damage the liver, and apart from jaundice there is no known complications, and this syndrome is considered harmless because it doesn't usually cause any health problem, and as a result no treatment required, but it's important to make sure that the person doesn't have another more serious condition. So and now let's talk about non-alcoholic fatty liver disease and alcoholic liver disease. So non-alcoholic fatty liver disease, it's build-up of extra fat in liver cell caused by obesity. Also it can be diabetes mellitus, hypertriglyceridemia, and also corticosteroids. And it's asymptomatic, but there is hepatomegaly, AST less than ALT, and and increased echogenicity on ultrasound. So and this treatment just lifestyle changes. So I will show you what this stage. So and it's like a healthy liver. It's this fatty liver. It's a fibrosis and cirrhosis. And now we talk about this stage. So next is alcohol-related liver disease. It's caused by excessive consumption of alcohol, and it more often leads to cirrhosis. So it's asymptomatic, or it could be mild upper quadrant pain, fever, and for diagnosis it's have to be history for alcohol consumption, hepatosplenomegaly, cholestasis, elevated aminotransferase, and look here, it's as you see, AST will be more than ALT here, so it's difference between these two conditions. Okay, and treatment is abstinence from alcohol. So next is cirrhosis, and the most common causes are alcohol abuse and viral hepatitis, especially B and C. Also it's autoimmune hepatitis, primary biliary cirrhosis, Hemochromatosis, Wilson's disease, drugs, and also cryptogenic, so no cause found. And symptoms, it's a spider nevi or navy, so it's like here. Also pedal edema, palmar erythema, and caput medusa, it's like here. splenomegaly, testicular atrophy, and nail changes. So, and it's important to know, is this condition compensated or decompensated? If it's compensated, it's asymptomatic or non-specific symptoms such as fatigue, for example, and decompensated when there is upper GI bleeding, ascites, mental status changes, and if it's compensated, so asymptomatic, it's very important to prevent these complications. So this person have to get an upper GI endoscopy, so to determine the risk of variceal bleeding. Okay, so next let's talk about some syndromes and how to treat it. So if it's a hepatorenal syndrome, so creatinine clearance will be less than 40, serum creatinine level more than 1.5, urine volume less than 500, and urine sodium level less than 10. So, and treatment, it's liver transplantation, but if it's early stage, you can also so you can treat it with aggressive expansion of intravascular volume with albumin and fresh frozen plasma, and by avoiding of diuretics. Next, portal hypertension. It's so diagnosis. So it's duplex Doppler ultrasonography, CT or angiography, and treatment if it's without ascites, with ascites but without hemorrhage, it includes a low sodium diet and diuretics. So next it's hepatic encephalopathy, and it's a elevated arterial or free venous serum ammonia level, and treatment is lactulose and antibiotics. Ascites, it's an abnormal accumulation of fluid in the abdominal cavity, and it's very important to make to do this paracentesis for determining whether ascites is caused by portal hypertension or by another process. So, and treatment is sodium restriction and the use of diuretics, large volume paracentesis and shunt. Okay, so I think that's all, and thank you very much for watching this video. I hope it was helpful for you, and see you next time.